spine can be neutral here. We can also, do we have like a small rolled up pillow or something we can place under her forehead so she can stay relatively straight? Yeah, like a towel, rolled up towel or jacket or something.
You don't mind, Dave?
Yeah.
Now, if we don't have any of this going on and the person's head is rotated, you got to take that in consideration when you're doing a lot of these tests, that there's already a rotation, and that rotation is probably occurring down the first 3, 4, 5 segments. Okay? So what I'm doing now is a central posterior to anterior on the spinous process. When I perform that movement, what motion am I producing? It flexion, extension, side bend, and rotation?
Extension.
Extension. Okay, because I'm approximating the spinous process. I find C7, T1. You got to be careful when you're in these upper segments because you're going to induce a lot of what's it? Cervical? No, not pain. Cervical motion at the same time. I find that the central PAs benefit me the most assessing the mid to lower thoracic spine. The idea here is you're going to find the spinous process, you're going to place your hypothenar eminence right over the spinous process itself. You're going to start a compressive force. You're going to start very light at first and then slowly ramp up the pressure until you feel like you get the full amount of force. And then you'll move down to the next one. How's it feel there, Bree?
My face is hot, so I turn it sideways, but everything feels fine.
Okay. So you start to do this. Now, if I find an area of hypomobility, I feel like, oh wow, that's really tight. I might start to do right there my treatment mobilizations. I can do grade 3, 4 Maitland's, or I can do a prolonged hold in that area. If there are no contraindications, I'm feeling a lot of hypomobility, I might do a thrust technique. I couldn't do it up this high. I'd be way too high. But so just moving in that manner along the spine. You can also do a single-handed method as well. Getting your hypothenar eminence and then just doing just a slow ramping up, and I'm just pushing straight down, trying to approximate the ribs. Okay. What did Olson say is the technique for flexion? Using the transverse process, these two fingers. So that's what we'll do next. Now I'm going to assess flexion motion in the thoracic spine, okay? Now using my rule of threes, or my guideline of threes, if you will, if I'm at the spinous process of T1, where should the transverse process be? Should be somewhere in the immediate area right to the side. So I'm going to find the transverse process that I want. And I'm going to place my fingers on both sides. Other things I double check for, you know you have those coastal transverse. When I'm looking to do rib techniques, I find the apex of the rib, which on her is right here, and then I slide my fingers down and in, and I get to a stop there.